Local response teams will soon be rolled out across Melbourne so that contact tracers can identify outbreaks more quickly using specialised knowledge. Let's bring in our reporter Patrick Murrell. He's live for us in Melbourne. Pat, the Premier's been defending today taking so long to introduce these teams into the way that the system runs there.
That's right, Ash. We know these localised teams have been used extensively on the ground in New South Wales to get the outbreaks under control there, as well as more recently in regional Victoria. And it's something that public health experts have been calling for a while now, all the way back at the start of the first wave. In fact, only a few weeks ago, in front of an inquiry, one of the government's own epidemiologists, Dr. Charles Alperin, identified one of the deficiencies within Victoria's contact tracing system as that lack of localised knowledge. Now, these centres will be based in the north, east, southeast, south and west. They'll have specialised local knowledge, so faith leaders, community leaders who can identify people who are parts of certain groups so that outbreaks, when they appear in those areas, the contacts can be identified and traced more easily. Now, when asked why this hasn't been rolled out in Melbourne before now, Premier said that a cost-benefit analysis was done, and given the number of cases, it wasn't said to have been useful before then. Take a look.
Well, this comes into its own when numbers are very low, and that's the position that we're moving into now. This is about continuous improvement. It's not about saying that, there isn't an opportunity to do better. It's looking for and often it'll be very, very small improvements.
Now, the Premier is still seeking to improve Victoria's heavily criticised contact tracing system, and in fact, teams are now headed to New South Wales to see what they can learn from what's being done on the ground there. Now, the Premier says that this is not an admission that New South Wales is doing things better, only to see if there are different ways that Victoria should be doing things once case numbers get low again.
There's no rule book, there's no playbook, there's no kind of guide here. This is something that none of us have done before, and therefore you all learn from each other. And there are plenty of insights that we've provided to New South Wales and Queensland and South Australia, and it's a proper model where we share not just resources, but we share our experience and our insight so that everybody can do the very best that they can do.
Now, today as well, Ash, reports out that between the first wave in Victoria and this second wave, the brakes were put on contact tracing and the teams were scaled down. When asked if this was a mistake, the Premier said that there was no right way, no rule book on how to do this. Take a look.
When you believe, to the best of your judgment, to the best of the advice, that you had it beaten, only to then clearly we hadn't, you have to learn from that.
Now, Ash, we all know businesses have been very concerned about this roadmap to reopening. It's a lot longer than they thought it would be. When I asked the Premier about what the effects of this lengthened road to reopening would be on the unemployment rate in Victoria, he said that modelling is yet to be done, although more announcements would be forthcoming within the week.